I'm going to talk to you today about a common problem that I see in my practice. It's called fibromyalgia. I'm Charlie Smith. I'm a physician at UAMS, which is the University of Arkansas in Little Rock. I have been seeing patients for many years and see fibromyalgia patients very often in the office, and I find that this is a very common problem. It's said to affect as many as 2% of the population. Most of the people that are affected are women in middle age, actually probably 10 to 1 over other population groups. The condition is characterized by generalized pain. So whenever I see a patient who complains of pain over their entire body, more times than not they're going to have fibromyalgia. Patients with fibromyalgia complain of pain everywhere, or often everywhere, but sometimes it's focused in the upper back or mid-back area. So these patients, in addition to generalized pain, they have multiple tender points. Again, these are most commonly in the upper back and shoulder areas, but they also are present in the arms, around the elbows, around the knees and thighs, and can be elicited in many points. This is a light pressing that causes tenderness in these patients. It doesn't typically cause tenderness or pain in other patients, and it's very distinctive and different than what you see in patients who do not have fibromyalgia. In addition to this, patients almost always have severe insomnia. They can't get to sleep. They tend to wake up frequently. They don't get a restful night's sleep. And as a result of all of this pain and lack of sleep, they have severe fatigue. This creates a very challenging picture for the patient and for the treating physician. There's no one obvious treatment approach, so you have to take multiple approaches to the treatment, and it needs to include exercise programs, stretching, and medication would be the three things that I would like to focus my treatment approach on, although there are other things that can be tried. There's been some recent discussion about gluten-free diets in these patients, and I don't think there's any evidence for this, but a few patients have told me it helps them. So dietary approaches might be something that we learn more about down the line for these patients. But for medication, exercise and stretching is not specific to fibromyalgia, but I think a good exercise program, starting with a walking program, possibly becoming more vigorous to the point that they're exercising up to 5 days a week for 45 minutes at a time is helpful, as well as stretching programs, or perhaps even just participation in a yoga class where there is non-aerobic movement and involvement of the musculature to help engage the muscles and increase tone and decrease the sensitivity of some of these areas by that kind of active management. As far as medication goes, there are a couple of antidepressants that have been shown to decrease the way the brain processes pain and helps these patients cope much better. The ones that I use are amitriptyline, which is otherwise known as Elavil, and trazodone, which I like better because it tends to cause fewer side effects. So one of these two I think should become in many ways the cornerstone of treatment, and is usually taken before bedtime, and it's primarily to help sleep and to help the brain process pain differently and helps patients tolerate their symptoms a lot better. Other medication, if this doesn't do the trick, might include Lyrica, which is a type of neurological agent that's used for seizures and other pain syndromes. It is sometimes helpful to use Neurontin or gabapentin, which is also called gabapentin. And these are kind of trial and error approaches that I might use in patients, certainly not all at once, but I might combine, say, an antidepressant with one of these two agents, so I'll put a little space there. And in addition to the trazodone noted above, I will often use one of the other medications called SSRI or similar medication, such as Prozac, but two other agents that are similar to SSRIs are Cymbalta, and then the newest one is called Savella. So these medications are helpful to a degree. I think, again, some of them are expensive. Cymbalta and Savella are expensive, so unless you have good insurance that'll cover this, that might not be the greatest thing to do. But I would typically, in addition to exercise and stretching program, have the patient on trazodone and either Cymbalta or Savella, and depending on how that works out, might substitute either Neurontin or Lyrica for this. In addition to these things, I think other modalities of treatment that can be very helpful include massage therapy, and in some cases I have recommended acupuncture. So it's helpful to see the patient's back. I like to use email for progress reports because it's often helpful to make multiple adjustments in the treatment program, and frequent visits for a while, certainly for the first year or year and a half until you get on a stable program that seems to be effective. Although this is the cause is not known, and it's not curable. Most patients, in my experience, can be helped greatly by a conscientious and caring physician that will see the patient frequently and be open to adjusting the treatment program. So that's my approach to fibromyalgia, and if you have questions, you can send them to me at cwsmith@uams.edu. You can also log on to my website, www.edocamerica.com. Thanks very much.